Hi, welcome to ASH 2022 here in New Orleans, the Big Easy. We're here live at the exhibit center at Lymphoma Hub, okay? So I wanted to update you guys. My name is Dr. Lee from MD Anderson Cancer Center, Department of Lymphoma. I am an oncologist that treats lymphoma. My specialty lies in Hodgkin's lymphoma, mantle cell lymphoma, and T-cell lymphoma. We're part of the rare lymphoma led by Dr. Michael Wong at MD Anderson. So I would like to talk to you guys regarding one of our abstracts that was accepted for oral presentation for mantle cell lymphoma. It was a phase 1/2 study of zilovertamab plus ibrutinib. I'll call that Zilo for short. In relapsed refractory CLL, mantle cell, and marginal zone lymphoma. As you know, ROR-1 is a new novel target that has been developed and appears to be synergistic with the BTK signaling pathway. And in preclinical studies, when we were able to block both pathways, it appears to have significant clinical and biological activity in combination with ibrutinib. And I'm sure everybody knows about ibrutinib. It has been a superstar for the past 10 years. Obviously, there are more data coming out, which I'm not going to discuss at this point, but we can talk about it later. But in terms of the Zilo plus ibrutinib has been studied, and the study design was part 1 was dose finding for the CLL mantle cell group. Part 2 was the dose expansion, followed by part 3, which was the randomized study of 2-to-1 2-to-1 randomization of Zilo plus ibrutinib versus ibrutinib single arm in relapsed refractory CLL. We enrolled approximately 33 patients in the mantle cell group. 40% of them are currently still on trial. CLL patients have completed all their treatment, and therefore we would like to present you our update on the safety and on the efficacy. Number 1, the safety. We were concerned, obviously, the zilovertamab is a new antibody combined with ibrutinib, and I'm sure everybody has experience with ibrutinib. There are some toxicities that we would like to know in combination with Zilo. So the neutropenia, we did not see an increase in the neutropenia and the neutropenic fevers. The neutropenic fever rate was observed at 1%. And in terms of the atrial fibrillation, of which everybody's worried about, it was about 9%, which is within the historical literature findings anywhere between 6 to 13, 14%. So we were very pleased with the safety profile of the combination of Zilo plus ibrutinib. And in terms of doing a deeper dive into the efficacy and mantle cell, we're very excited. Obviously, we had a very rapid and durable response to mantle cell lymphoma. Almost 20% of the patients were able to achieve a complete remission in 3 months. That was sustainable. At 26 months, we had knock your socks off 43%. Okay, that goes very well with the historical reference. I'm sure you guys have seen Simon Rule's paper in a British Journal of Hematology, which was updated by Dr. Dreiling. And if you look at those numbers, you can see the reference, not for comparison, but just for reference as to where we are. And we were able to see also the Ki-67 high risk, TP53. They were showing median progression-free survival of almost 3 years. So we're very pleased of this promising and encouraging response. So therefore, and I'll get to it in the end, the kicker, which will be the phase 3 study, but I'll go back and talk to you a little more about the CLL data. The CLL data, we were very, as I said before, the safety data was very encouraging, that we did not see an increased risk of these AFib and neutropenia. But in the response, we had overall response rates greater than 90%. Okay, so we were very pleased. And then the progression-free survival. This is actually the biggest kicker, I think, for this abstract, is that we have 42 months follow-up, 100% PFS, 100% PFS for those with TP53 alterations. So if you had a deletion or a mutation, you had 100% PFS. So we are very excited. Obviously, we'll be taking this, back to the labs, trying to figure out the mechanistic ways, but we do recognize that Zilo will be adding on to the BTK pathway, which appears to be very synergistic. So we're very excited about this pathway, which we'll be further studying. So with that, I do recognize that the mantle cell and the CLL data is very encouraging. For the mantle cell, we have overall response rates close to 90%, CR rates 43%. CLL, we're seeing greater than 90% response rate, 42 months, TP53 altered patient, 100% PFS. Yes, the numbers are small. I do agree. The numbers are small. Treatment naive 5 patients, relapse refractory 5 patients. Okay, the laws of small numbers. I do recognize that, but this is very exciting. So that allows us to study it further. And now the preview, what's going to happen next is going to be a phase 3 international double-blind placebo-controlled confirmatory study in a mantle cell lymphoma relapse refractory. It's going to be Zillow plus ibrutinib versus ibrutinib plus placebo. This will tell us whether this observation is real or not. So with that, I would like to thank you guys for listening to me. Obviously, if you have any questions, feel free to reach out. We'll be more than happy.